I think one of the biggest challenges facing healthcare providers in Asia is the challenge of adopting IT technologies into hospital. There's always been a problem between balancing admissions and discharge together. It's making patients frustrated when they have to wait a very long time to get admitted or even to be discharged from the hospital. Nowadays, with technologies in the market, it's things like patient discharge system. It's almost possible to discharge a patient 50% faster than traditionally it would have taken. So these are where hospitals are trying to get some of these technologies in place. But the challenge again is then always cost. I think cost is a big issue for healthcare providers. I mean, they've always have to balance between budgeting for technology and also budgeting for medical equipment. So they have to strike the correct balance between budgeting for both of these fields, because these are two key elements within any healthcare provider's facility. I think some of the biggest hurdles has always been budgets and also the human resource factor. I mean, whenever hospitals they do get the budget, it's always a problem of getting the correct people to start implementing this solution. So there's a lot of legacy systems within hospitals, and patients are always demanding for quality care, improve in service, and hospitals are trying to match up to their requests. But I think the biggest hurdle here is always budgets and also following the technology trend. I think good communications are vital to healthcare. Nowadays, with technologies, with things like electronic medical records, communication is becoming vital. There needs to be a good collaboration between clinicians within a facility or clinicians within multiple facilities. One example is like when you want to share digital X-ray within facilities. Traditionally, you have someone picking up a piece of X-ray and shipping it to the next hospital. But with communications nowadays, we can transfer a digital X-ray image from one facility to another facility, even if it's a couple of 100 kilometers away, with just a blink of an eye. And that's how vital communication is nowadays. And it's very critical to healthcare when a split-second decision means between life and death. I think some of the good examples would be Kyushu University and also Taiwan Mobile, where we've given clinicians access to patient records while they're working remotely. And again, traditionally this wouldn't have been able to be achieved, but with communications nowadays, especially with Taiwan Mobile, we are allowing doctors to work remotely from their house or even a remote hospital and access clinical records from the city. These solutions were achieved by using solutions like Secure Portable Office, like SPO from Nortel, where it works. It's just a USB thumb drive, and the doctor just has to plug it into their laptop and they can access clinical records remotely. I think the feedback has been positive, especially now when there's been a shortage of doctors throughout the world. One doctor is supposed to be managing 2 or 3 hospitals being a specialist. So with Secure Portable Office, he's able to log in to Hospital A even while he's working in Hospital B. So it's been a challenge, but doctors are they're very appreciative of such technologies, and hospital administrators are happy. One, it's a cost-saving measure, and 2, they can get the doctors log in and do their work whenever they are needed to. I think the effective way, it minimizes manual work and it minimizes waiting time. The good example would be King Fahd Hospital. It's a group of hospitals where it's 4 hospitals, 269 primary care, which handles close to about 650,000 patients annually. They've deployed Nortel's IVR system, IP telephony, and contact center solution. And with having all this and our unified communication now, it has improved patient care. It's gone and speed up the process of hospital processes and everything. So these are some of the ways where communication has actually helped hospitals, and this is one of the very good examples, King Fahd Medical Center. I think besides UC, hospitals nowadays are adopting RFID solution to start tracking most of the materials within hospital, and nowadays they have taken a step further and started tracking patients and even their own staff. Besides that, more hospitals are starting to adopt patient discharge solution. As I mentioned earlier, the discharge process is a lengthy process. So by adopting patient discharge, they're actually cutting the discharge process by close to 50% than it traditionally would take. I think these are some of the technologies. And again, having remote workers and also doctors visiting multiple facilities. More hospitals nowadays are looking at remote solutions such as secure portable office, where doctors can connect remotely to the primary hospital, access records and things. So I think moving forward, the technology trend, most of these hospitals, they're trying to adopt technologies like this besides unified communications.